No, you cannot get your cast wet. If the wet padding sits on your skin for too long, it can damage the skin. It would be like if you left your hand in the bathtub for a month. If you had surgery, wet padding sitting against either the pins or your incisions can increase the risk of infection or other wound complications. If a post-operative cast gets wet, you should contact your surgeon right away. He or she may want you to come in for a new cast. Sometimes a waterproof cast can be used instead of a regular cast. Please ask your provider if this might be an option for you.
If just the edges get a little wet, you can dry the cast with a hairdryer on cool. If the whole cast gets wet, or there is wet padding over incisions, then the cast should be changed for a new one.
There are many different commercial products on the market to keep casts dry. You can also use garbage bags with tape or rubber bands to seal them. However, try not to use plastic bags from the store, as they often have small holes in them. Please keep in mind that none of these products are foolproof, and water can still get in around the edges even if properly applied. Try not to submerge the covered cast in water, as that will increase the risk of water getting in. To better protect the cast, consider tucking a towel or washcloth around the top of the cast to absorb any extra water that leaks through.
Itching is one of the most challenging parts of being in a cast. If it itches, try tapping on the cast or using a hairdryer on the cool setting to blow cool air over it. You can also try scratching the other hand. Most importantly, you should never put anything down the cast to scratch or itch. This can cause significant damage to your skin.
Most often, you do not need a sling if you have a cast. However, the sling can sometimes be helpful when you are at school or out of the house. This helps remind you and your friends that your arm is broken and needs protection.
To keep your cast dry in the rain or snow, you can try putting a bag over your cast. Don't put your hands under running water. Instead, try wipes or using minimal water.
Yes, elevation helps reduce swelling, which can reduce throbbing and pain. You should plan to elevate for at least a couple days after any injury. You should continue to elevate for longer than that if the arm or leg is still painful or swollen.
When elevating, make sure the injured extremity is above the level of your heart. If the cast is on your leg, you should put any pillows under your calf, not your heel, to prevent any skin damage or pressure wounds over your heel. If the cast is on your arm, you may need to get in a reclined position to position the arm properly above the level of your heart.
If your hand or fingers have increasing pain, any new numbness or tingling, or are no longer pink and warm, then you should call your physician immediately and report to an emergency department. Other things to look out for include increased swelling and throbbing of the fingers, or being unable to move or bend the fingers. A good rule of thumb is that if you are concerned something is wrong, it is worth checking in with your provider.